Mommy Makeover Pre-Op. Welcome. We're going to talk about Mommy Makeover Pre-Ops for a bit. This is Stacy Lassiter, our physician's assistant, and she's super important in your pre-op visit. She's who you're going to be seeing for your pre-op. She's going to go over a bunch of stuff with you during your pre-op time. Your pre-op time is a time for you to ask questions. And many of you are going to have a lot of questions, and you may not know all the questions you're going to have until you read your pre-op packets. So make sure you've read through your pre-op packet that is sent to you by our patient coordinator, Samantha, and make sure that you look through all of that and write down your questions so that you can bring those to ask our ladies in the office who are helping you with your pre-op. During the pre-op, there's going to be several other things that we're going to be doing that are going to be important. One, we're going to take some pictures of you. So we're going to give you special underwear to wear during those pictures so that we can get good photographs of your body. Those photographs are very important. They're vital for us during surgery. We use those pictures, we put them up on the board during surgery so we can see them and I can refer to them. They'll be on the wall right next to me. And I can refer to them during surgery so I can see if there's a difference from one side to another, not only in your breast area, but in your waistline, in your flanks, in your hips, in your tummy. So I can make sure if we have extra fatty tissue in one part or a muscular difference on one side, we can try and accommodate for that and try and get you as symmetric as possible. All of us are different. We're all built different. We all look different, and most of us aren't symmetric at all from side to side. But when you come to surgery, that's our chance to try and correct that for you and get you as symmetric as possible. So those photos are super important. Additionally, you're going to be given some prescriptions for medications during your pre-op. You're going to get a pain medicine, and that can be one that's kind of your choice. Usually we use our narcotic pain medicine. If you haven't had narcotic pain medicine before, typically we prescribe Norco. That's a good one. It usually works very well, but if you find that doesn't work for you, we're certainly amenable to prescribing different things that work for you. We want you to be as pain-free and up and walking around and moving after surgery as possible, so we want to be able to take care of that the best we can. Additionally, one of the things that keeps people from being up and walking early after surgery is nausea. Unfortunately, with anesthesia, sometimes people get nauseated. Not everybody, but some people do. And our anesthesiologists are excellent at stopping people from feeling sick and doing different things like scopolamine patches and giving them medications during surgery. I get a lot of feedback from our patients that our anesthesiologists did a great job and they couldn't believe how much better that anesthesia went for them this time than the last time they had surgery somewhere else for whatever they had before. But we also give you some anti-nausea medicine. So here's the recommendations on nausea. Is we're going to give you a medication called ondansetron or Zofran. And that's a medicine you can take on an as-needed basis. Additionally in that, there's some other things you can do to help yourself. Number one, stay really hydrated. Hydration is super important. Women have lower blood pressures. And when your blood pressure dips down in the 90s or even below 90, which women's blood pressure often does, especially when they're laying down and especially after a surgery, that's going to make you feel nauseated when you stand because your brain's going to tell you, hey, I'm not seeing enough blood, lay back down. And that's what it's trying to do. That's why you don't feel well when you stand sometimes after surgery, or just if you've been asleep and you wake up and you stand up too quick, you get lightheaded. Your brain's telling you, lay back down. So to help you with that, drink lots of fluid. The more fluid you have in your system, the more your blood pressure will go up and the more it will help that. The other thing that we don't think about often is after we've had a big surgery, we need some sugar, some food. Most of us haven't eaten the whole day of surgery. And then we go home and we don't feel much like eating afterwards either. And now we've gone more than 24 hours and we've been fasting the whole time and we've had surgery. So our body's trying to heal itself and recover, and we've got no sugar in our bloodstream to supply our cells with nutrients. That makes us nauseated. So one of the most important things you can do after surgery is try and get some sugar in your system. So people think they're going to go home and drink a bunch of water. Water is okay, but you need to have something else with some electrolytes to replace the electrolytes you've lost and something with some sugar. So don't go get diet drinks. Drink something with sugar in it. So this is your excuse to go buy that soda you wanted to buy and buy plenty of it. You should be drinking at least a gallon a day. It's much more than most people drink, a gallon and a half a day.
Of fluids, not just soda.
Yes, not just soda, but of fluids. But things like Gatorades, soda's good, and especially the soda I like is ginger ale. Ginger's a natural antiemetic, which means an anti-nausea medicine. So ginger root, ginger cookies, ginger ale, very, very good at helping you post-op recover, feel better, and get up and walking soon. It's important you're walking right away. That walking part's really important, so we want to get you up and doing that as quick as possible. Stacy's going to give you prescriptions to help with all of your post-op needs. She's going to take your pictures, and she's going to go over your consent forms with you and make sure you've read through those and understand them completely and understand all the risks and complications of your surgery.
A couple things about your consent forms. You're going to be signing those consent forms when you come into the appointment. So make sure that you receive them. You'll receive them via email from one of our coordinators. And if you don't receive them, make sure you contact our coordinator to find out where it is. Usually it's sent via email and it can land in your junk email. So if you haven't checked that, make sure you do, because a lot of times that's where it ends up. Make sure you've thoroughly read through it, because you're going to have lots of questions and we're going to make you sign those consents that day. Also, a couple of other things. If we've requested you to get some labs or an EKG or any pre-operative medical clearances or any of that, that needs to be done prior to your pre-op appointment. It's an imperative that we have that information, because that can delay your surgery. So if you have questions about any of that, make sure you contact our office prior to, but please try to get that done before you come in and see us that day. One other thing we'll be doing too, Dr. Green didn't mention, is your sizing. If you are doing a breast augmentation or a breast lift with an augmentation, typically when you come in during your pre-op visit, we actually size you that day. And that's essentially, we try on different sizers in a bra, especially for those of you that don't really understand what 200 cc's or 300 cc's is. You'll be able to kind of visualize what that looks like in your clothes and in a bra. And that kind of helps you make a decision as to what size of implant you want to choose during surgery.
Thank you, Stacy. That's super important what she just talked about, and brings to mind one more thing that I just wanted to mention with that whole sizing part and cc's and things like that. We speak in cc's. Most other people speak in cup size and bra size, but we're going to try and teach you that language of cc's so you understand it. And an important thing that I will have talked to you about in your original consult, when we bring you next door to examine you, after we do the original consult, we examine you, we're going to talk to you about cc's that are appropriate for breast size, and Stacy's going to help you with that. Here's an important concept. When we place an implant in a person's body, it needs to fit. And I don't think people always think about that. No. But think of it kind of like shoe sizes. There's going to be things that fit and things that don't fit. And I like shoe sizes. You know, you might go to Nordstrom's or wherever you like to shop and try on some shoes, and you might, or look at shoes, and you might see a shoe that you go, wow, that one's really cool. I really like that shoe. That's a beautiful shoe. I want that one. And it might only come in a size 5. The shoe salesman might say, hey, that only comes in a size 5 and you're a size 6.5. Well, what do? Do you buy the shoe? Probably not. The reason is because it's not going to be comfortable, and you're not going to wear it, and it's not going to be comfortable because it's going to be putting excess pressure on your tissue. That excess pressure is super, super important when we're talking about implant size. So when I examine you the first time, when Stacy and I first see you, we're going to take some measurements of your breast, and we're going to measure the width of your breast and the height of your breast on your chest. We're going to measure where your inframammary folds sit, where your nipples sit from side to side. Part of that is so I can tell you about how one side is different than another, and we all are different. Stacy will tell you every patient we see is different from one side to another, and so that's important information for you to know. So when you're looking at yourself post-op, you'll realize, oh, I was a little different to start, so they may not be able to correct all of these differences, especially if we're not doing a breast lift. The other part of that is that size. That breast width has something to do with what width implant and therefore size implant will fit there. If we try and use an implant that's too large, it will cause problems. And so I have very specific recommendations. Again, I'm a physician. Stacy's a healthcare provider as well. We go into healthcare to take care of people. And one of the things that's most important about us taking care of people is really giving them good advice to begin with, giving them good knowledge, and helping you be an integral part of smart choices for your own body. Certain implants are going to fit and fit well and look perfect and not cause you problems. Implants that are too large, we've seen tremendous problems that patients have had where they've had implants placed at an outside facility, not ours. These implants have been far too large for them, and they can cause some significant permanent problems. So Stacy's sizing process with you that she goes through when you come in for your pre-op visit is very, very important in achieving the best long-term outcome for you, as well as the best health for you in this whole process. That is Mommy Makeover Pre-Ops. You have anything else to add?
I don't.
There you go.